One question I get from a lot of my guy friends is, can I get checked for bladder cancer? And while I'm glad that my guy friends are concerned about getting checked, and we hear a lot about prostate cancer and getting your prostate checked, bladder cancer really doesn't work that way.
What's really important is just to pay attention to your body, pay attention to your pee if you're concerned about bladder cancer, because bladder cancer usually shows up as blood in the urine, painful urination, urgency, frequency. Those are some of the symptoms. But those are also common symptoms for a lot of things. Actually, when I was first experiencing symptoms, I did what everybody does. I got on WebMD and I started reading, and you read everything from you might be dehydrated to bladder cancer. And so I had to go through a process to get checked because I had some symptoms. One of the first things my urologist did was check my prostate because the symptoms that I was experiencing were also in line with prostate issues. The next step was a CT urogram, which is a CT scan of your urinary system. And in that, they were looking to see possibly if I had kidney stones. And that's where they noticed something that was a spot in my bladder that could potentially be cancer. So the next step was what they call a cystoscopy, which is done in office. It is not very comfortable. And if a guy wants to get checked for bladder cancer, if you don't have symptoms, I wouldn't recommend just going and getting a cystoscopy for the heck of it. They use local anesthetic and they stick a camera in your urethra in the office, and you're awake and they're looking inside your bladder to see what they can see with that camera. When the doctor saw that spot, he was still suspicious, so then he moved to a biopsy, or what's sometimes called a cystoscopy, or sometimes called a TURBT. TURBT, transurethral resection of a bladder tumor. And so at that procedure, the doctor went in with the camera and also a scraping tool. I was under anesthesia, so I was asleep the whole time, and they scraped the suspicious spot in my bladder to take it for biopsy. And so that TURBT's results came back as high grade, non muscle invasive carcinoma in situ. One of the reasons that I speak out is because I know that guys in general are not the type to want to always go to the doctor to get checked for things. They want to be tough guys. They want to tough it out when they have symptoms. And topics around the bladder, the urinary system, the prostate, these are all sensitive topics that guys don't really want to talk about either. But what's most important is to listen to your body. And if there's something in your body, something going on with your body that is out of the ordinary, you should speak up. You should talk to your primary care physician, like I did. And it could be just that you are dehydrated, or it could be something more serious. And it's best to get it checked because if you catch it early, it's much easier to deal with. So don't be a tough guy. Listen to your body and pay attention to your pee.